So, hello, this is Tim here. We're here at Innovatica Congress 2018 in Saarbrücken. I'm here with Dr. Dominik. He's a well-known biological dentist and functional medicine doctor, so he combines those two aspects in his practice. And I want to ask him a few questions. First of all, why is biological dentistry the missing link in functional medicine? Can you explain that to our clients?
Yes, it's the missing link because functional medicine mostly looks into how is your diet, how is your lifestyle, and also searches for toxins. But when I did the courses, they were not really checking the whole mouth. So they of course they check for heavy metals maybe, but dentistry was kind of like a percentage of what was taught in functional medicine. But you should look at the mouth as the mirror for your overall health. This is, you check for all interference, because the dentist from a functional point or a craftsman point of view installs materials that are not just toxic but also detrimental for your health. For example, amalgam fillings which contain mercury, which everybody should know this, and we probably learned this in functional medicine. But also you leave dead teeth in your mouth, which is root canal treatment. So root canal treated teeth are very toxic because it's a dead organ. No other medical department would allow a dead organ to be in the body, like
you told today,
like a tooth, like a toe, like a dead toe, or anything else organic that is dying is always getting rid of in medicine, but not in dentistry, because dentist just looks from a functional point of view, and the only symptom that is treated is pain. It's a pain treatment. But which chronic disease is connected to pain? Does depression hurt, blood pressure hurt, or diabetes hurt? No. So this is a problem because it's chronic and it's silent inflammation mostly, and you have the toxins in these teeth. There are bacteria living in it, anaerobic bacteria which produce thioether mercaptanes, like very highly toxic compounds. Then the mercury from the amalgam fillings. You even get currents in your mouth because you have amalgam filling and a gold filling next to each other, or you have a titanium implant plus a crown, which is out of another metal on top. So there's galvanic elements in the mouth. Then you also metals, for instance, are general. They don't have anything to do in your mouth. It's just for craftsman stuff. And nowadays you have Wi-Fi, you have cell phone radiation, and if you have metals anywhere in your body, mainly in your mouth, you have like an antenna for all these interference, which leads to big problems. So if you phone, normally the radiation goes from the cell phone tower to your cell phone and back. If you have a metal implant in your mouth, it goes to your cell phone, to the implant, and back. What it does, it's amplifying the frequency of, or the fields of 400 to 700 fold. And if you phone with the 4G, you increase temperature around the titanium implant about 3 to 4 degrees, which is high fever. So that's why there's a lot of osteolytic processes around titanium implants. So if it's coming out in soon, it's coming 5G, they probably fall out because it's getting like 1 more degree. It's very bad.
Okay, thank you for your answer. But we see also in my practice, in my functional medicine practice in the Netherlands, I see a lot of patients with severe problems like chronic fatigue, headaches. Basically, they feel very, very bad all over. Pain problems all over their body. Can you explain to the clients how does low-grade inflammation in the mouth start, and how does it contribute to all those complaints?
So inflammation is what your body does initially. So your immune system is there to fight against viruses, bacteria, microorganisms, parasites, by producing a inflammation. That's just normal. So if you cut yourself, there will be this red skin around the wound, which is your lymphocytes fighting against bacteria they want to invade. So an inflammation is a normal reaction. The chronic version is if your body has to deal with something like the wrong bacteria, dysbiosis, or any other things on a daily basis and on a subclinical level. This is, for example, when you have a root canal which leaks out bacteria which produce the toxins. So if you have an immune system, which you hopefully have, you probably end up with a cyst on the tip of your root. Yeah. And the cyst is nothing else than just a capsule full of thicker tissue to just help the body get rid of the toxins and bacteria. Yeah. So your body will produce TNF-alpha, interleukin-9 beta, NF-kappa B as a chronic sign of inflammation just by fighting against the organisms living in there. Yeah. Also is able to produce lymphocyte reactions, kind of like for vaccination. So if it gets into contact with gluten, for example, you can get allergic to this. Or to the toxin, you can also get allergic to toxins. And this is very bad. If you have like toxins from root canal, like thioethermercaptan, and you also become allergic to it, so your body builds antigens against. No, it's the antigen, and your body builds. What is it in English? Reacts to it by building. What is the opposite of antigen? I'm missing the English word. Antibodies.
Antibodies.
Yeah, the antibody. It just
yeah.
builds antibodies against the toxin. So you have to detox it through your liver, which puts a strain on it, and it also you get allergic to it, which is very bad because allergy is not dose dependent anymore. So your body is reacting to it all the time, chronic, just because it's there and it's allergic to it. Because your immune system is there to fight against the foreign stuff. Pretty simple.
Can you explain? There's a lot to do with wisdom teeth. They about 80% of the people have the wisdom teeth took out.
Yes.
Can you explain what happens afterwards when the wisdom teeth is took out, and what can happen? What can contribute to the chronic inflammation after the wisdom teeth took out?
Yeah, what he's referring to is the cavitation problem. So if you take out the wisdom teeth, in the first place, mostly surgery, which is not prepared for the whole body. So diet is not on point, you're missing micronutrients, and then the surgeon will do this pretty fast and like aggressive, so high impact surgery to get it out pretty fast. And you're probably as a patient in hibernation mode. So your vitamin D3 level is low, you eat gluten and cow's milk and sugars and a bad diet. So what happens is, after removing of the surgery, there's a big trauma and your body's just not able to heal it because you're in hibernation mode, which ends up in chronic silent inflammation, bone areas where the wisdom teeth or other teeth that you extracted were. So these are silent inflammations called cavitation or necro-osteolysis, which stands for neuralgia-inducing cavitational osteonecrosis or osteonecrotic bone. You can also say it's called ischemic bone disease. So it's kind of like a huge dumping area where your body just stores everything because the metabolism is down, and you have like anaerobic bacteria living in there producing the toxins, and you have your nerve, which is a trigeminous nerve, inside of this inflammation.
So this will cause fatigue symptoms.
This is connected to your adrenal glands, your small intestine, and this will, in 80% of our cases, result in chronic fatigue. In the other 20%, it's the opposite. It's more inflammation, but 80% chronic fatigue is it's normal because your body has to produce an inflammation reaction, which it does by activating adrenaline, noradrenaline, and cortisol in your adrenals every day on a subclinical level. So you just deplete yourself, and then you're like tired every day already in the morning. Yeah.
So, Dr. Dominik, what is the solution to this chronic inflammation in the mouth, and what do you do for patients like that with these complaints?
Yeah.
What's your solution?
The solution is, we call it the all-in-one concept. It means, so this is developed by me and Dr. Ulrich Volz. Dr. Ulrich Volz invented the term all-in-one concept. That means we are preparing the body in order to boost its immune system, to get the diet on point. This is my food design concept. It starts like 8 weeks prior, depending on your current vitamin D3 level, LDL cholesterol, and pretty much a very functional medicine approach of elimination diets and so on, and a particular form of micronutrition. It's called the bone healing protocol, based on high dose of vitamin D3, microminerals, etc. So to K2, magnesium, cofactors, activated B vitamins, boron, to prepare the body for surgery. So we boost the immune system, we relax the autonomic nervous system to get over level of 70 nanograms per milliliter of vitamin D3. And then the all-in-one concept means we remove all the interference, which is all metals, all root canals, and all these cavitations in one appointment or appointment sequence. So you come in, get IVs on the day before, and on the surgery day you get another IV, pre-treatment, during treatment. Then I do the surgery, remove everything, and install where it's necessary ceramic implants when we remove root canals. So initially you get your teeth back with a material that is 100% biocompatible and doesn't cause any more interference. So in this all-in-one concept, your body is able to regenerate fully and you will go into parasympathetic mode. Afterwards, it's of course the healing and osseointegration phase, and the teeth will come on top like 6 months later.
Use also something special, not a lot of dentists use.
The APRF? Or?
Yeah, the APRF.
Of course, the protocol is also, we have to clean everything perfectly, we disinfect with ozone, and we draw blood after the IV to make APRF membranes, which is membranes made out of your own plasma, which contains stem cells, 1.2%, and other micronutrients, growth factors to help regenerate bone and tissue very well at the spot. So this is mandatory. This is in the protocol.
So you can regenerate your own tissue with the
APRF membrane. It's very good for tissue, also for bone. It acts like a matrix, releases these cells, stem cells, growth factors, and it also you don't have to use materials that are made out of bovine stuff or pig stuff. So
it's
your own material is always better, right? Yeah.
So you're really getting to the cause of the disease.
Yeah, we're getting to the cause of the disease, and it's very important to do this 100% because then the results for your healing come. So you can't do it like halfways.
Yeah. Okay. Thank you very much.